We're so glad to see everyone here. We are just delighted to host this Healthy Babies Press event. Welcome to Family and Children's Place. And one of the reasons we wanted to host this event is that healthy babies are center of our mission and a part of the work that we do every single day with families here at Family and Children's Place. As the leading agency working with children and families who are impacted by abuse and violence, we know that there's no more important job than preventing abuse. It is critical that we make every effort to stop and prevent abuse, because only when we stop and prevent abuse can we really raise happy, healthy babies in our community. Family and Children's Place is delighted to be a part of the Healthy Babies Initiative. We partner through our Hands service, and this is where we work with families in their homes, providing training, resources, and education all around helping to create happy, healthy childhoods. And this includes helping families actually create toys to build skill sets, helping them assess the safety of their home, and helping them assess safe sleeping. We are part of the Healthy Babies Initiative with 14 other wonderful organizations. We're just one of those great organizations doing this incredible work. And all 15 organizations have committed to reducing infant injury and reducing infant mortality in Louisville Metro. And many of us are working and adding services. Some of us are continuing the great services that we do. But we have all made commitments to these three critical activities. First, to counsel and work with parents on assessing safe sleep and to make sure that baby has a safe place to sleep. And for those families who are in need of a safe place to sleep, we get them connected with the resources so that that baby does have a safe place to sleep. Secondly, we assess the medical home, making sure families have medical homes and insurance coverage, because it's critical that families have access to quality medical care. And last, we make sure that we are assessing the smoking status of all parents and making sure that smoking cessation opportunities are available as needed to all families. So we couldn't be happier to have you all here today to talk about this wonderful Healthy Babies Initiative. We're so excited to hear Mayor Fischer is going to come now, share with us some of the progress that we've made over the year, and we're really excited about continuing this great work throughout this year. Mayor Fischer, thank you so much for being here to help us kick off this wonderful event.
Thanks, Pam, and good morning, everybody. It's always wonderful to be at an event where we have some of our youngest citizens as props. We've got one sleeping citizen here, it looks like, post a meal. And Dr. Moyer, is that your... All right. Well, that's normal. So I want to, Pam, thank you for the terrific work you and your team have been doing here in the great new facility. We can still call it a new facility here, right? And on behalf of all of our citizens, I want to say great job to you guys and your team for the impact that you guys are making on so many lives. We got staff members here. Thank you all very much for stepping up for our community. This initiative, or this month, obviously is dear to our city because from the very first day we took office, we've been talking about city values around a healthier city and an even more compassionate city, and certainly a city of lifelong learning as well. And these three goals all really come together when we're talking about today's focus, which is our youngest citizens, because we want every woman in Louisville to have, obviously, a safe pregnancy, and every baby or boy, girl to have the greatest chances to flourish like any kid. Each and every kid, when they're born, should have the same opportunities to reach their full human potential. And that's the underlying goal of everything we do. We know we have challenges in our community, but the real failure is if we don't get after those challenges. So one of the ways we addressed this was this past January, we announced the formation of Healthy Babies Louisville, and it's a coalition of 13 public and private organizations that are bringing our city's best healthcare and social service minds together to improve infant health. And Healthy Babies Louisville has already made some progress, we're happy to report, in some key areas. It has reinstituted the Fetal and Infant Review Board, which investigates the causes of fetal and infant death each quarter. It has also increased referrals for prenatal and perinatal services through the Metro United Way 211 call center. And we have been making progress in bringing our city's infant mortality rate down. Our current rate is 6.7 deaths per 1,000 live births. That's better than some of our peer cities, but we're still trying to do better than what the national average is, which is 5.8. So we're at 6.7. The national average is 5.8. Now, you got to be careful when you're talking about averages, because within those averages, there's a lot of disparity. And what I want to focus on is that the infant mortality rates among African-American babies in Louisville is nearly double the overall community rate. And nobody is happy about that, and it's not acceptable to me, and I know everybody in our community as well. So these big challenges like this, and there's many of them, they're community challenges, and they require a community response. So everybody's got to be at the table. Government, the private sector, schools, hospitals, as well as individual parents and caregivers. And we've got to do everything possible to move Louisville babies and their families so they can celebrate their child's first birthday and second birthday and on in there. Our other speakers this morning are going to talk about the factors that put children at greater risk in their first year. And you're also going to hear about resources available to parents and caregivers here in our community. So as a father of 4 kids, and Yvette Gentry and I were talking about that on the way over, we had 4 kids, all under 7. We had 4 teenagers at one time, from 13 to 19, and we were talking about how parents make the decision to grow their families, and oftentimes when you have multiple kids, it's just kind of a haze, and you look back at the pictures and say, boy, how did we get through that period in our life? And it's a beautiful period in parents' lives and the community lives, but we just want to make sure that everybody has all the information that they need and all the support that they need in the community, starting in the prenatal stage, obviously. For moms, and I say it repeatedly, you know, if you are smoking, quit smoking. Don't have smoking in your house. Obviously, if you're using any types of drugs or alcohol excessively or at all, stop it. You only have that one chance to make sure that your baby comes out healthy, and then go from there. And there could be no more important decision that you make in your life as a mother than the birth and the health of your child. So with that, we've got a lot of great community resources that we'll be hearing from today that can help others get the information to save lives and have more healthy babies in our community. Thanks, everybody. I would now like to introduce Dr. Sarah Moyer, who's an outstanding contributor at our Public Health and Wellness Office, but also a mom of 3.
Yes.
And twins, and just only one this time, right?
Only one this time. Still enough.
And your daughter or son?
Son.
Son is now 3 or 4 months old?
4 months old yesterday.
Yeah, so she's got it all going on, and people like you are, I don't know how y'all do it, but Dr. Sarah Moyer, good job.
Just last week, he was trying to talk my husband into having 4, so.
4, okay, well, there we go.
We'll see. So thank you, Mayor Fischer and Pam. The loss of any baby before its first birthday is very tragic. And as Mayor Fischer said, I'm a mother of twin 2.5-year-old boys and a new 4-month-old. I can't imagine the heartbreak of that happening. But unfortunately, about 23,000 babies never live to celebrate their first birthday every year in the U.S. There's no definite ways to prevent many of the leading causes of infant mortality, which are preterm birth, birth defects, SIDS, and accidental injuries. However, we do know some ways to reduce that risk. So with that in mind, let me offer a few tips to the young parents out there, those of you who are thinking about becoming pregnant, and to the new grandparents and aunts and babysitters. Healthy Babies Louisville, working in partnership with Metro United Way, has resources to help you follow those tips. Just call 211. First tip, breastfeed. Breast milk is the best milk. And research has indicated that babies who are breastfed exclusively for the first 6 months of life have up to 70% less chance of SIDS or sudden infant death. Unfortunately, Kentucky has one of the lowest rates of breastfeeding in the country. But things are changing. Our hospitals are all working towards being baby-friendly, which promotes breastfeeding at birth. And also many businesses and agencies in town, including Louisville Metro government, are adapting and expanding their paid parental leave policies. There are many, many health benefits to paid parental leave, one of them allowing mothers to have extended time at home to ensure successful breastfeeding at the start. Paid parental leave is one of the best policies out there to ensure that all children in Louisville start life with an equal chance. Tip number 2, which we've heard, is don't smoke. We've all heard about not smoking in pregnancy, but secondhand exposure after the baby's born can be just as harmful. Smoking during pregnancy can cause preterm birth and low birth weight, and also more birth defects, increasing the chances of infant mortality. Smoking both during pregnancy and after has been proven to be a big risk factor for SIDS as well. Metro 211 has links to the quit line and classes for you and your family members. Please call. The third tip, which we also heard, is never, never shake a baby. Pregnancy and motherhood is tough. Babies cry, babies don't sleep. You just heard my baby crying. But remember, you're never alone. If you're feeling sad, worried, or frightened during your pregnancy or after your baby's born, please seek help. Talk to your doctor and call 211 to be connected to community resources. If you feel pushed to the limit, put your baby in a safe place like a crib, take a break, and call for support. It will get better. And the last tip for today is follow the ABCs of safe sleeping for your baby. After many years of research, we know the safest way for your baby to sleep is A, alone, B, on its back, and C, in a crib. So throughout this month, it's Infant Mortality Awareness Month. Follow at Lou Metro Health for more tips on how to keep your baby healthy through its first year. Our next speaker, Erica Jane, will fully explain the ABCs of safe sleeping. Thank you.
Don't let the binder scare you. I'm going to do this ad lib anyway. But I would like Gail Hankey to come forward, and I want to do this in loving memory of Charlie. Charlie was 3 weeks old, and while napping on Daddy's chest on his belly, Daddy woke up, but Charlie didn't. And they are Charlie's Kids Foundation. They travel the country trying to get the ABCs of safe sleep in. So this is for Charlie and all the other babies. We are working so hard to get to their first birthday and beyond. So A is alone. Oh, yeah. Thank you, Gail. So if you think in Kentucky, every 5 days we lose a baby. In Louisville, on our child fatality review team, we review the deaths of 1 to 3 babies every single month. Every single month. Can you imagine? 1 to 3 babies. In Kentucky, you have 70 times more likely to die of unsafe sleeping than you are of a car crash. It's just crazy. We sit at that meeting every month and just leave. It just feels hopeless, but it's not. Just by behavior change or changing the environment, we can change this thing around. So, alone. We don't want your baby lonely. Bring the baby in your room. Room sharing is a good thing. You get in the zone with your baby. They smell you. You smell them. Sometimes that's not a good thing. But you get in the zone with the baby. They know you're there. You can respond for breastfeeding. But then you put the baby back in their bed. Now, that could be a pack and play like we have here. It could be a bassinet. It could be a crib. But you have the baby there. Also, it is, just like Dr. Moyer said, when you've had all the fun you can have, the baby's screaming, you've done everything you know what to do, you lay them down. You walk away. You don't leave town, but you have a place to put the baby. Now, A was alone, on their back, and babies do not choke and die on their back. When I raised my daughter and when all of you all were raised, you were put to sleep on your belly because we believed if you threw up, stuff would come out and you would not choke. I have great pictures up here to show. In fact, it's the opposite. If you are on your back and you throw up, it has to go against your cough reflex and gravity to actually go down in your lungs. It doesn't do that. But if you're on your belly and you throw up, that liquid is right there at the opening of the airway. In between coughs, which that baby is going to do, they go, and there goes that liquid right into the lungs. So, always on the back, naps at night. In the middle of the night, if you're frustrated, don't change routines. Also, if I may, I'm going to roll around the side here and talk even louder. which is hard to imagine. Let me move through here. Don't leave your babies for routine sleep in a car seat or any sitting product. They need to be able to expand their diaphragm for breathing. And if they're crunched in a reclined position or a sitting position, they can't do that. So, sleeping in a car seat while you're watching them for a very brief time on the road is fine. But once you get home, get them out of the car seat. Okay. This one happens to have an early habit, which we're trying to get her help. Smoking actually affects the breathing mechanism of a baby. Babies born to moms who smoke have problems regulating their breathing. That's what makes them at high risk for SIDS. So, secondhand smoke, any one of these risk factors is bad. Start adding the risk factors up. These babies have a lot going against them. So now we have on the back in a crib, pack and play or bassinet. There's a lot of things that have to go. Now, a baby can sleep in a onesie or they can sleep in a sleep sack. They can sleep in little pants and a top. We just don't want them overheating. Overheating is a risk factor. Okay, I'm not covering you up, baby. All right. When you smoke, you may have a premature baby or a baby of low birth weight, which makes them at a higher risk for everything. So, get that baby to full term. When we first had babies change position, we went from sleeping on the belly to the back or the side. These things were used to position them on the side. It's a positioner. Don't use it. On the side, babies could wiggle down and their face become on the side and they smothered. No positioners, strictly on the back. Bumper pads. Babies do not roll over fast enough to harm themselves in the crib. Even the mesh ones, they can suffocate or get trapped. If you leave it in there for the baby who gets older, they use it as an escape route. So, get the bumper pads out. Blankets, not needed. You've got a sleep sack or a little outfit. Even if you tuck it like we used to show pictures of, they don't need a blanket. The little onesie, the sleep sack, you're fine. Pacifiers are a great thing. Pacifiers reduce the risk of SIDS. Research doesn't know why, but they think the sucking action keeps the baby from getting into a deep, deep, dangerous sleep. Even if the pacifier falls out at night, you don't have to go, and stick it back in. Supposedly, they are at a good level of sleep. So use a pacifier. Establish breastfeeding first, then offering. This is of concern. It's a what? Anybody know? It's a Wubbanub. The packaging says only use when supervised. Now, I do not want to be sued by the Wubbanub people. I'm just saying read the package of any product that you use. On a tiny newborn, do you think this could be a problem? So, enough said about that. We lose babies in this community because they've been propped on pillows on their belly in an adult bed. Kind of a problem. So, we've seen them on adult beds, obviously with pillows around them, so they don't fall off the adult bed. But they manage to get over to the pillow and their face is in the pillow. Not a good thing. Carry your pack and play with you to another location. And finally, everybody has to have toys, but when the baby goes in, everything comes out. So, wrapping up the items out, the do's and don'ts, I think we've covered them all. Always read the instructions that go with the things that you're going to use for your baby. Make sure that the products the baby's sleeping in meet the standards. Don't use old cribs that might be on a recall. Well, anything could be on a recall. But register your products, use them correctly, maintain them, and alone on their back in this safe crib. Let's get our babies there to the first birthday and beyond. Thank you all for being here and the support for Healthy Babies Louisville. Let's keep it going. Are we going to do a demo now? I think we have a demo with a beautiful model. Is that what goes on now? Allow me to trip over the products? Okay, Daddy, I think you know this. Voila. How precious. And, you know, if they're on their belly, they can't do anything with their arms, their legs, or they're kind of trapped. This way, what's the first thing you get to see in the morning when you slept all night? Is that smiling little face. What a beautiful face. All right, Daddy, you done good. All right. I'm not sure what comes next. Do we have questions?
Sheldon's going to say a few words.
Oh, Sheldon, say a few words.
Yeah, so I just, thank you, Mayor, thank you, everyone. So Safe Sleep became very important to me. July of 2015, I went to a funeral of my 4-month-old cousin, William Charles. And in that place, I had this experience of how could this happen to my family? How could this be? That this small child is now deceased of SIDS. Our family, typically, when we have homegoings, it's not a mourning, but it's a celebration of life. However, this child never got to see life. And so in that space, I thought about my own experience, and speaking with a friend of mine who is at Bellarmine working on his PhD, we both have been single fathers. I have a previous daughter, Jasmine, who's 11, and when I raised her from birth, she slept in her car seat beside my futon that I folded out in my efficiency apartment. And I had no knowledge that that was unsafe. I reached over, I rocked her, gave her her passy, and sitting with my friend Jerron, who both of us somewhat learned people, it was astonishing how limited knowledge we had about SIDS, that it had completely missed us, that I had gone to all the immunizations, all the doctor's appointments, and still I had no knowledge about what was safe and what was not. And so, as an advocate for the community, in knowing that this affects our African American community on a much higher prevalence than it does other communities, I want to advocate and share a voice and lend a voice so that Charles isn't forgotten, and so that other children don't have that same experience and live to see 366 days. Thank you all.
Any questions?
How did Sheldon get his daughter to behave? So
Yeah. You can still hear mine screaming in the background.
Yeah, I got one for Erica. You've been doing this for a long time. We've all done multiple stories with you. What's new or different in the field that you pretty much dedicated your life to at this point? Is there anything going on that we should be doing stories on?
Healthy Babies Louisville. You're right. I've been doing this and watching this since the 90s. Of course, I started when I was 2, so I was a prodigy. But everybody, we have physician involvement, and there's new information, and our preemies are doing better. But I think the more research we read, and our public is more informed. But like Sheldon said, educated people aren't finding out why smoking makes a difference. You know, if you talk to somebody and say you need to quit smoking, well, you need to tell them why. It's not just another person saying quit smoking. It definitely affects your baby's brain. Or not leaving him in a car seat. Well, most of the time car seats aren't used properly anywhere. So there's a risk of being strangled, as well as this not letting the baby breathe as stretched out as possible. So I'm not sure that's answering your question completely, but I know with more voices that we're going to make a difference in this. But grandparents are the hardest nut to crack because we did it differently. But what we have to tell people is that babies died before. We just never talked about it. because there is nothing worse than to lose a child. I mean, I lost pregnancies, and people said, well, you'll get another one. You'll have another one. There's no way you can go and say that to someone who's lost a child. But we're talking about it now, and we're not going to let it go. We're talking about it, and people are listening, so we're going to make a difference. All these people in the room have committed their agencies and their time and their compassion to change the world. We really are going to do it. So,
Picture with you all and moms and dads and babies up here. Pam, do you have announcements to make?
about upcoming. I know we're going to have a town hall on September 22nd.
The town hall is on September the 8th.
Oh, I'm sorry, that's right, it's this week. Okay, I think you should probably be doing those messages, or that, you want to come up here? This is Stefan Edwards. Thank you. I'm sorry. Remove that last information.
So Healthy Babies Louisville is celebrating Day 366 all September long. This Thursday, September the 8th at 6 o'clock, we have a town hall, which features some really great voices here in the city. We have our own Dr. Kelly Pryor, who's going to be speaking. We also have Dr. Gil Liu from U of L. And we have some other physicians and environmentalists as well, and they're going to be there to answer your questions about infant mortality and how to prevent infant mortality and to discuss the disparities around infant mortality in Louisville, Kentucky. So that's September the 8th, 5:30 at Louisville Central Community Center. And then also September 22nd, we have a citywide birthday party, and we are very excited about that. Please bring your family, please bring your little ones, your little one-year-olds and younger, or if you're expecting, please come. We're gonna have all of our Healthy Babies Louisville partners there because we have a larger space now. We're going to be at the St. Stephen Family Life Center. That's September 22nd at 6 p.m. until 8 p.m. We are going to have cake, so please come out and enjoy. We're going to have some great crafts and games for the babies. It's all going to be centered around celebrating Day 366. And so we're just excited to have you all out. Thank you so much for coming. And please spread the word. The hashtag is Day 366 or Celebrate Day 366. Healthy Babies Louisville is on Facebook. We are posting a message every single day around the prevention of infant mortality. So please reshare, repost via Twitter, via every avenue of social media, because the more that people know, the better we can do. We are really looking to make sure that no baby dies before their first birthday. That's really our goal. We know that sometimes it cannot be prevented. There are some things that just happen. It's genetics. But what can be prevented is safe sleep and also abuse. And so we're really going to be putting those messages out there to make sure that we have a severe reduction in infant mortality in this city, and we can do it. So thank you all so much.
This has been a Metro TV production, a public service of Louisville Metro government.